Good morning. Appreciate all of you being here. Sorry we're running just a few minutes late, but we will get going this morning. Before we get started, let me read a few things. First of all, this is the Joint Subcommittee of the Government Operations on Education, Health, and General Welfare, and we are now called to order October 15th, 2025. Madam Clerk, will you please take the roll?
Senator Crow. Senator Jackson.
Here.
Senator Oliver. Senator Seal.
Here.
Senator Sutherland. Senator Rose.
Here.
Rep. Crawford.
Here.
Rep. Glenn. Rep. Lamberth.
She's here for Rule 65.
Oh, okay. Representative Pelton Haynes. Representative Marsh.
She's here for Rule 65.
Representative Rutter is here.
Okay. Rep. McKenzie. And Representative Fritz. Okay.
Okay, we detect quorum. Before we get started, let me just read one other thing. Remind the audience and the members that the action taken by this committee can be to extend the entity 1 to 8 years. We can terminate, which would put it in a 1-year wind down. We can restructure the entity, or we can make no recommendation at all. Our recommendations will be drafted into individual sunset bills that will be heard during the full committee during the 2026 legislative session. There is a public comment sheet. If there's not, we'll get one down there. To my right, to your left, and if there anyone from the audience would like to make comments, you need to sign up. So with that being said, we'll get started first with the Health Facilities Commission. We'll ask both the auditors and the agency to come up, and we'll look forward to your presentation. Let you know you made the news this morning, so. All right, if you would, agency, if you would introduce yourselves, and then we'll ask the comptroller to do the same, and then we'll ask the comptroller to present the findings. So we'll start with the agency. If you'll tell us who you are and make sure your mic's on, please.
My name is Mary Kane, and I'm one of the legislative senior auditors.
Thank you.
My name is Sheila Raymer. I'm one of the legislative senior auditors.
All right, thank you. All right.
I'm Logan Grant, the Executive Director of the Health Facilities Commission.
I'm Caroline Tippins. I'm the Director of Licensure and Regulation.
John Carr, Director of Administration.
All right. Well, thank you all for being here, and we will go to the comptroller and let them present their audit findings.
Good morning, Chairman and members of the committee. My name is Mary Kane, and with me is Sheila Raymer, and we are legislative senior auditors with the Comptroller's Office Division of State Audit. Before we get started, we would like to thank the Health Facilities Commission and staff for their cooperation, professionalism, and assistance during our audit. Today, I will be presenting the results of the 2025 Sunset Audit of the Health Facilities Commission. The Commission's mission is protecting patients and promoting quality in healthcare facilities. The Health Facilities Commission was created on July 1, 2022 by consolidating the Department of Health's Office of Healthcare Facilities and the Health Services and Development Agency. This also placed the Board for Licensing Healthcare Facilities under the Commission's authority. In 2024, the Board for Licensing the board was dissolved and the commission expanded to 15 members, fully consolidating oversight. With this consolidation, the commission not only took on new responsibilities, but also inherited long-standing challenges, most notably a backlog of overdue facility surveys from the Department of Health. This backlog impacted the commission's ability to meet regulatory expectations from day one. The commission oversees the Licensure and Regulation Division, which provides direct services to ensure the care quality within healthcare facilities and includes addressing the backlog. The commission also serves as Tennessee's state survey agency for the Federal Center for Medicare and Medicaid Services, or CMS. We reviewed the commission's statutory responsibilities, the phase-out of certain certificate of need requirements, management's processes for completing nursing home and assisted care living facility surveys and complaint investigation requirements, management's plan to address the facility survey backlog, the penalty assessment and distribution process, and follow-up on prior recommendations for the State Abuse Registry, which became the Commission's responsibility in July of 2022. Our audit scope covered the period of July 1 of 2022 through May 31st, 2025. In this presentation, we will discuss the finding. At the end, we're happy to discuss any additional topics within the report. To understand the finding, I will provide an overview of the process. The Division of Licensure and Regulation conducts on-site federal and state surveys, which are inspections that assess compliance in areas like staffing ratios and emergency preparedness to ensure healthcare facilities meet required standards for quality and safety. All Tennessee healthcare facilities must be state licensed to operate, and if the facility participates in Medicare or Medicaid, they must also meet federal survey requirements. When necessary, the division also investigates complaints while performing the on-site surveys, which increases efficiency but also adds to the workload. Surveys matter because when surveys are delayed, facilities and residents may go years without oversight. This means lapses in infection control, staffing, or other areas could go undetected, potentially for years, directly putting vulnerable Tennesseans at risk. Failure to meet federal survey deadlines not only puts patients at risk, but also triggers penalties or federal intervention. As mentioned earlier, when the commission was created in 2022, it inherited a significant backlog from the Department of Health of 270 overdue federal surveys, 176 of which were nursing homes. By April 2025, the number of overdue nursing home surveys increased to 192. This starting point created significant challenges that the commission continues to work to address. To make the backlog worse, in October of 2022, CMS changed its guidance to allow the general public the ability to file complaints, not just the home's residents or employees. This increased complaint volume and made surveys more complicated to complete, leading the state to fall in the rankings from 31st to 47th out of 52 states and territories in 2024. The Tennessee Healthcare Association was concerned about the commission's backlog and lobbied the General Assembly to pass Public Chapter 263 in 2025, which requires all nursing homes to be surveyed by December 31st, 2026. As of 2025, CMS ranked Tennessee 39th of 52 states and territories for completing federal surveys on time, which means the commission may be delayed in identifying the nursing homes that pose risks, resident safety risk. Finding 1 is on page 20 of the report. We focused our work on nursing homes and assisted care living facilities because they make up the bulk of the complaints received. The finding discusses 3 areas: late surveys, late complaint investigations, and data reliability issues. Despite initial and continuing actions, management has not yet cleared the recertification survey and complaint backlogs, and may face challenges in eliminating the backlogs by the December 2026 deadline. Our analysis covered the entire population of 670 active nursing homes and assisted care living facilities during the audit period. We found 341 facilities, or 51%, were not surveyed within the 15-month federal and state required timeframe, and 22 providers had gone at least 5 years without a survey, a substantial lapse. Inconsistent scheduling methods across regional offices and insufficient monitoring by central leadership means some facilities may not be scheduled for surveys when needed. The Commission's complaint system becomes critical when residents, families, or the public raise concerns about a resident's care or safety. Complaints are prioritized by urgency. For example, immediate jeopardy complaints which indicate a serious risk of harm or death must be investigated within 2 business days. Lower level complaints have longer timeframes. Management has not addressed critical health facility complaints within the required timeframes, resulting in an increased backlog of complaints and risk to patient care and safety. From July 1 of 2022 through April 17, 2025, the Commission received 13,096 complaints related to nursing homes and assisted care living facilities. Of these, 5,534 complaints, or 42%, were not investigated within the federal timeframes. Days late ranged from 3 days to over 5 years. This means thousands of families who raised concerns waited months or even years for resolution, during which time unsafe conditions could persist. The Commission relies on 2 information systems: the CMS-owned Automated Survey Process Environment, or ASPEN, and the Department of Health-owned Licensure and Regulatory System, also known as LARS. Because ASPEN and LARS data are not reconciled, regional managers may overlook facilities entirely when scheduling the required surveys. In practice, this means a facility could miss both its required survey and complaint investigations, leaving serious risk unaddressed. Management has taken steps to address the backlog, which include combining complaint investigations with surveys to increase efficiency, reclassifying positions and raising salaries to aid recruitment and retention, and consolidation of 3 regional offices to 2 in order to reduce costs and balance workloads. While management has taken these steps without milestones to measure progress, it is difficult to know whether these actions will be enough to eliminate the backlog by the December 2026 deadline. Since many of these changes were implemented during the audit, their effectiveness remains unknown at this time. To address these risks, we recommend that management develop and strengthen internal controls for scheduling and performing the surveys and complaint investigations. They should also update the annual risk assessment with controls to mitigate the risk noted in the finding. In short, timely surveys and complaint investigations are essential to protecting patients and promoting quality in Tennessee's healthcare facilities, the Commission's very mission. Management concurred with our finding. Excuse me. We would like to thank the chairman and the members of the committee for their time and consideration. This concludes our presentation of the 2025 Health Facilities Commission Sunset Audit. We're happy to answer any questions.
All right, thank you so much for that presentation. And to the committee, I will ask you if you've got any specific questions related to how the audit was conducted. Let's pose those right now. If not, let's let the agency respond, and that may resolve any questions you have. Or any questions to the auditors on how they conducted the audit? All right. Seeing none, then we'll ask, oh, we have one. Representative Glenn, you're recognized.
Thank you, Mr. Chairman, and thank you all for that report. That was very detailed. Just one quick question. How long did it take to do that audit? Like, what was the time frame from when you start? I may have missed that in your briefing.
We started the audit back in like November of '24, and then we ended, our audit period ended May 31st, but it still took a couple months to write the report and that type of stuff. Is that what you were referencing?
Right. So basically about 4 months of actually in the facility and getting information, and then about 2 months to write the report.
Around that, yes, sir.
Okay, thank you.
Thank you, Representative Glenn. Are any other questions from our committee to the auditors on mechanics of how this was done? Chairman Crawford.
Yes, thank you, Mr. Chairman. I've got one question. In your discussion there, you said we were anywhere from 3 years to 5 years of people that had not completed their audits. Is there any over that 5-year period?
Not that I'm aware of.
Thank you.
All right, thank you, Chairman Crawford. All right, seeing no other questions, we'll go to the agency and let you respond. Tell us again who you are and who you're with, and make sure you're into that mic.
Yes, sir. Thank you, Mr. Chairman. I'm Logan Grant, the Executive Director of the Health Facilities Commission. With me is the Director of Licensure and Regulation, Caroline Tippins, and our Director of Finance and Administration, John Carr. We also want to thank the Comptroller's Office for being very helpful to us during the audit. They even, things that didn't end up in the report, there were a lot of discussions where they gave us a lot of ideas of ways that we could do things better. And so it was really a great experience for us and strengthened our ability to perform and perform these very, very important duties. So as she said, we concur with the finding of the audit. We are working on our backlog. We have instituted a number of strategies to try and deal with those. For example, we've been able to improve our recruitment by shutting down the Middle Tennessee Regional Office, where it was very challenging to be able to recruit surveyors because our surveyors have to be licensed healthcare professionals and generally with experience in the field before they can become surveyors. So by eliminating the Middle Tennessee Regional Office and shifting those survey positions out to the East and West regions, we've been able to reduce our number of survey vacancies from 24 down to 3. Which really helps us have folks, the more positions we have, the better, the more we can respond to these numerous complaints and recertification responsibilities. We've also started collaborating with other states, adopting best practices that we've learned from other states. And that has also helped us, things like the idea to go ahead and do complaint investigations while we're out on a recertification. We've also engaged in a lot of retraining of staff. An example of that would be our complaint intake unit, where all those complaints are initially filed with the office. Our complaint intake unit will evaluate the complaint and set it on identify it based on its risk to patients. The highest level, obviously, being an immediate jeopardy. And as of 2020, about 42.3% of all complaints were identified as an immediate jeopardy, which means that we have to respond to all those within 2 business days. Based on some retraining and adopting best practices from other states, we've been able to reduce that to 4.6%. So a drastic reduction, and that brings us roughly in line with other states for whom the national average is about 4.5% of all complaints being prioritized as immediate jeopardies. We'd like to say that we have in this calendar year, up until the federal government shutdown, we have been able to make a lot of progress getting through our recertifications, trying to get them all done and before the deadline on December 30th, 2026. When we started the year, there had only been 4% of nursing home facilities that are Tier 1 facilities that had been recertified within the required time frame. That had increased to 9.7% of Tier 1 facilities that had been recertified within the time frame. That said, the federal government shutdown has substantially harmed our ability to go out and do these, because we have been informed by CMS that we cannot go out and do recertifications during the government shutdown. So the only thing we can investigate, because we are partially federally funded, are IJ complaints. So until the federal government is operating again, we won't be able to work on that backlog, which is very problematic for us. And that's the simple part of some of what we're doing, but we're also have filed some requests for additional positions with the governor's office. We're going through that process presently to try and secure some more resources to be able to meet the increased demands on our workforce.
All right. Does that conclude your presentation?
Yes, sir.
All right. So we'll turn to our committee to see if there's any questions. And Chairman Haynes, you recognize.
Thank you, Mr. Chairman. Logan, in the last few years, there's been a lot of changes to CON. Do you feel that your agency has been able to keep up with those changes effectively?
Yes, we are on track to be able to begin the new licensure process for burn units, PET MRI, and NICU units. That has been a lengthy process. We began in January of this year with technical advisory groups composed of providers who work in those fields, so we can identify some quality measures that would be making sure that we're regulating on quality. And we have every expectation that it'll be up and running by December 1st of this year.
Okay, thank you.
All right. Thank you. I think next is Representative Glenn. You recognize.
Thank you, Mr. Chairman, and thank you all for being here. So a question I have is, how long have you known there was an issue with these surveys, complaints, and all that? How long has that been an issue for the commission?
Since day one. Since the responsibilities were brought over to us, we inherited a backlog, substantial one, and then we've been trying to increase our capacity to perform surveys in the meantime. Every year that we've come before the General Assembly, we've requested additional positions, additional survey positions, that is, and we're hoping that we'll be able to obtain some to help us out. Us reducing our vacancy rate, we think, shows that we're able to actually do things with those positions now that we've moved our regional offices to East and West Tennessee, where we're a lot more successful in our recruitment efforts.
Yes, sir. Go ahead.
Thank you, Mr. Chairman. And you said year after year, you've come to the General Assembly and asked for additional support. Have you not received that support from the General Assembly? Don't lose your job now.
We have in some cases, because there's I believe 2 years ago, maybe 3, I believe we got 10 additional positions for when we were merged. A lot of those positions we had to use for things like a internal audit director that we didn't have, some information systems director, things like that we needed to run as an independent agency. To my knowledge, we've used it for, to my knowledge, I can't recall if we've gotten any additional survey positions in the past. Okay.
The last question, Mr.
Yes, sir. You're recognized. Go ahead.
Thank you. So on the complaints, I believe it was 3 to 5 years of complaints that have become backlogged. Have you made any effort to reach out to the complainant and let them know what you're dealing? I'm not saying they have to know that you're staffing, but that you're still working on their complaint, giving them assurance that that complaint has not been put in the bag and no one is looking at it. Has that effort been made to ensure them that someone is still looking into their complaint? I mean, 5 years is a long time to wait for a complaint.
Yes, sir. We agree. I know that we speak to a lot of complainants who call and check up on on our progress, Carolina, but I don't believe that we've done any mass communication to all of them at once to try and update them on the reason for our delays.
I'm sorry, Mr. Chairman. Last
That's
question.
fine. Go ahead.
So at this point, those ones who are 4 and 5 years old have no idea that their complaint is still in the hopper. They have no idea where that complaint is at. There's been no update on where.
We aren't proactively updating them by sending out communications, but when they reach out to us, we do give them, we explain the situation to them and where it's at. And some of those complaints that have been out 5 years were the majority of those are low-level complaints rather than immediate jeopardies. And what's the second highest?
It's on, go ahead.
So there's various levels of
No, it's on.
Okay, thank you. I'm going to get it right one of these days. So there's various level of triage, as Logan alluded to. Immediate jeopardy is our highest. There's non-IJ high, followed by non-IJ, and then there's medium, and then there's lower level complaints. And at the start of the complaint survey process, we do reach out to the complainant and we do notify them that we are out there and on site and ask them for any additional information. And we've also developed a new complaint portal. I think we should probably mention that as well, Granicus, where complainants can actually log in and check on the status of their complaints as well. So they are notified when it is transferred to the region, and they are also contacted before we initiate the survey.
Okay. Thank you, Mr. Chairman.
All right. Thank you. Senator Oliver, you're recognized.
Thank you, Chairman. Thank you to everyone here today. So I find this very disappointing, quite frankly, Mr. Chairman, to hear of these complaints and knowing that people's loved ones are sitting waiting to be cared for, and these surveys are directly tied to the health and welfare of elderly individuals. So I really hope that we find a solution to get in making this urgent to fix. Honestly, 5 years is a long time to be waiting. I have a few questions for you. One, I'm curious to know, you mentioned the levels of the complaints. What are the nature of these complaints? Have you categorized what these are and what they're dealing with?
It depends on the level. So your immediate jeopardy is going to be your highest level priority. That could be anywhere from appropriation, financial exploitation. There's also a separate state statute which mandates reporting of those events as well as a facility reported incident. And just as a notation, as the comptroller noted, there were changes to that made by CMS, which revised Chapter 5 of the State Operations Manual, which changed the priority and the ability to file a complaint and greatly increased our complaint workload. So we do have them categorized in accordance with CMS priority, and we routinely review those. So we've also created a high priority complaint prior to the comptroller's finding, and I don't believe that was mentioned. And those are units across the state which go out and address our highest priorities, and that has helped us reduce our complaint backlog, particularly with the immediate jeopardies.
Okay, thank you.
You're welcome.
All right. Thank you.
I have a few questions more. Chairman,
ahead.
thank you. And what is the ratio of staff that is assigned to these nursing homes? So per every surveyor, how many hospitals, nursing homes are assigned to survey?
So roughly right now, we have about 299 nursing homes. We'd have to go back and look at our total survey positions, but I would say less than, well, we've got 2 regional offices with regional administrators and 5 supervisors. They run a team of basically 9 surveyors each. So it's probably, we'd have to get the actual number, and we can probably run a staffing pattern for you with our total vacancy rate and surveyor position, but it is not nearly the number of nursing homes and assisted living facilities per surveyor. So we do not have enough surveyors, frankly, to meet our backlog of recertification and complaints. And as Logan indicated, we have greatly reduced our vacancy rate, which was hovering around 25% when we inherited it as an agency. Now we're down to basically 3 open positions. So we have increased our recruitment and retention, but still we do not have enough survey positions to adequately address the recertification and complaint backlog. We've tried to reclassify our positions. Most of our surveyors, you didn't answer this question, but they're registered nurses, licensed practical nurses, and only 1 dietitian and very few social workers. But by reclassifying our positions, that's allowed us to fill a lot of our vacancy rates. But still, we need more survey positions in order to address the backlog.
And what is that number? Have you identified what a healthy threshold is for a caseload for 1 surveyor?
So it depends, honestly, Senator. It depends on the number of complaints that we take out on a recertification. And there's a matrix in the state operation manual which limits the number of complaints we can take out on a recert. So when that becomes the case, then we have to break out the complaint and the recertification separately, which is double the workload.
Okay.
And so we'd be more than happy to provide you the matrix out of the state operation manual about the number of complaints. I think
One
that
last
might help.
question, Ms. Chairman. Have these surveys resulted in any, or complaints, excuse me, have these resulted in any lawsuits that resulted in any bodily harm?
We had,
Has the department or the commission been sued because someone has been waiting to address a complaint?
So certainly it can result in disciplinary action to the facilities. So there's two tracks that this can take. If it's a CMS certified facility, it can result in federal enforcement, which can be denial of payment for new admissions and civil monetary penalties, which are assessed at the federal level. And on the state side, provided state deficiencies are written, there can be state licensure discipline. All of that is available on our website for our facility action and abuse report, which we publish every month. And there have been a significant licensure disciplines during our tenure as an agency. We have not been sued about the backlog, but you're more than welcome to review the facility abuse and action report, and we can provide a copy of all that if you would like to see about the amount of state licensure discipline which has been done since our tenure.
Okay, thank you. Thank you, Chairman.
You are welcome. Let's see, Representative Fritz, you're recognized.
Thank you, Mr. Chairman. Thank you all for your time today, and thank you for the Comptroller's Office for the great report. Just one quick question. Do you track a metric of how many cared for individuals may have expired before the complaint is investigated? And if so, is that trending favorably or negatively now?
So as a requirement for a recertification survey, we have to review what is called the MDS population, which would show us the number and acuity of individuals in the facility and if any persons involved in the complaint would be living or deceased. So we can get you a definitive metric on that, but it really depends on whether we're doing a complaint survey or a recertification survey. And even if the individual is deceased, we can still review a closed file record. So they would still, the complaint would still be investigated even if the person is deceased.
Thank you.
Thank you. All right. Any further questions? Chairman Jackson, you're recognized.
Thank you, Mr. Chairman. And thank you all for being here. I appreciate the auditor's report, and Mr. Grant, I appreciate the Health Facilities Commission being here and giving your reasoning for some of the issues. What year was it you were passed off from the Department of Health for the survey responsibility to your department?
that was July 1, 2022.
Okay. So you were handed off, and that was some of the 5-year plan, or 5 years was handed off to you and several others. You said there was not a very good, surveys hadn't been done very well up to that point when it's passed off to you, or?
Oh, I'd say they had a backlog, and part of that was because of the COVID, shutdown during COVID. So during the COVID epidemic, they weren't able to go out and do anything except IJs, I believe.
I understand.
And so that created a lot of the backlog, although I believe there was a backlog even prior to COVID.
Okay.
So I would say I wouldn't put it all on COVID.
Yeah, I understand that. And thank you for that explanation. That certainly does make sense because COVID affected a lot of different things. So anyway, it was handed off to you. And did you have the resources to do these surveys when it was handed off to you? Or did you have to build your team up to make these surveys?
Well, first, yes, we had to rebuild the team because, as we said, we had a great number of vacancies, and there was some turnover after the merger when folks came from Department of Health, and so we had to replace those, retrain everybody, and our training for our surveyors can take generally at least 6 months. And depending on what they're getting trained on, I believe if it's long-term care, that can take up to 9. So 9 months after the point if we hire somebody before they can go out and be performing surveys on their own. So there's that. And then as Ms. Tippins mentioned, when CMS updated the state operations manual, chapter 5, which allowed complaints to come in from a lot of different directions, that drastically increased the number of complaints that we have to investigate. And I mean, I want to say between 50 and 60%.
So it was almost like a perfect storm with a lot of things hitting you at one time and you had to address, and you're just now trying to recover from that. Are we giving you are you getting the resources that you need, the funding that you need to be able to hire surveyors? I know in Middle Tennessee, the cost of the cost is excessive compared to west and east Tennessee. So you're able to hire surveyors there. Are you still able to, the funding that you get, what they get paid, are you able to recruit okay, or do you need more? The reason I'm asking this is because we faced this same type of scenario several years ago with TBI, with forensic scientists, and we weren't able to properly go get to the sexual assault kits. There was a huge backlog, and we were losing our forensic scientists to other states because we weren't paying them enough. And it takes up to 1.5 to 2 years to train a forensic scientist and a couple of $100,000. So we addressed that, and now that's been taken care of with TBI. Do we need to do some of the same things here with you?
Well, thank you for the question. I would say that our recruitment efforts have been successful. I think they would be even more successful, obviously, if we were able to offer more competitive salaries. We are having to compete with folks who are trying to hire nurses, and obviously there's a nursing shortage. Y'all have heard about that,
Yeah.
certainly by now. So I would say that we understand that the state has finite resources, and the General Assembly and the governor have a very tough job figuring out how to prioritize those. So we certainly respect the challenge there. I would say that if we were able to secure more positions, I think our success in recruitment would demonstrate that we would be able to use those resources effectively to deal with these challenges.
Okay. I know you're exactly right that it's very competitive, and trying to get nurses and registered nurses, LPNs into hospitals, into clinics. I hear that there's just a great shortage all over the place, all over the state. So that's all I have right now, Mr. Chairman. Thank you.
Thank you. Any further questions from our committee? Representative Glenn, you're recognized.
Thank you, Mr. Chairman. And a quick question to you all. When is the next follow-up for the inspection for the Health Commission?
I don't think that's been established yet.
Will it be the next year, any ideal when it might happen? We obviously have to figure out if the processes they're putting in place are working. So
We'll have to get back to you. I think will depend on what the extension is, as to how quickly we're able to go out.
Representative Glenn, I've been advised that what our committee will do, I think, is recommend an extension, and at that point, they will need to be back before us. So it really depends on us and what we do with the recommendation on extension. Am I correct on that? Okay, I'm getting a nod, so that's my understanding. Okay, thank you for that question. Good question. Any other question from our committee? Senator Seal, you're recognized.
Thank you, Mr. Chairman. Good morning. Thank you for being here. The 42% of complaints, or the 5,000 so complaints that weren't answered, are investigated timely. Did I understand you to say that those were IJ complaints mostly?
The majority are not necessarily immediate jeopardy complaints. We do have a backlog of IJ, but some of the lower level complaints that are older are just that, they're lower level. We are working on the immediate jeopardy backlog. And I would also add other states do have a backlog of complaints and immediate jeopardy related to the changes in Chapter 5. So unfortunately, that's not a problem just limited to Tennessee, Senator. It's a problem occurring on a nationwide scale.
Go ahead.
And can you just give me a reason why they're not answered timely? You may have already went over that, but do you care to tell me why they're not?
Certainly. We did not have enough surveyors initially to address the backlog of immediate jeopardy complaints. As Mr. Not only did we receive a backlog of recertifications, but we did have a backlog of immediate jeopardies when we were combined as an agency. So we have been working to timely address that. And as Logan indicated, we have greatly reduced our metrics and are working very diligently on coming into compliance.
Thank you.
Thank you.
Okay, thank you. Let me respond to the question that Representative Glenn had. It's my understanding that you guys are open for questions. Anytime we have a question about where we are, if we caught up or we behind, you are open to those questions. So I'd encourage the members to be sure and reach out to them and ask questions as you need to. Yes, sir. Go ahead. You're recognized.
I would also let y'all know that we do provide an annual report on nursing home surveys that is provided to the General Assembly, I believe, every February, January, February.
It is.
And that contains a lot of our metrics and performance and how we've done. And we're, as the chairman said, we're always available for comment or inquiry.
All right. Thank you. Any further questions from our committee? All right. Seeing none, how about from our public? Any public questions, comments? Seeing none, do we have a motion? Chairman Crawford, I believe you have something for us.
Thank you, Mr. Chairman, and I would ask for a little leeway here. I think you guys can see that we are very concerned about this issue. It affects each and every one of us, every district that's represented here on the House. And so that being said, I know you all inherited basically a bomb and it kind of went off in your face. And, but it's very, very important. 5 years is too long, period. There's no excuse for that. And I know your all's hands is kind of tied down with the shutdown, those type things. But 5 years, we just cannot have happen. So I'm willing to give you the time to fix this problem with the understanding that you guys know that we're very concerned about this. And if you all can't get the job done, then we have to answer to our constituents on why their family members or friends or neighbors are being mistreated. So I'm going to make a recommendation that we give you a 4-year extension for the Health Facilities
All right.
Committee.
Thank you for that recommendation. Do I have a second? Have a second, Chairman Jackson. We have motion seconds. Any discussion on the motion? Seeing none, we'll take a roll call vote in the Senate. Madam Secretary, please take the roll call in the Senate.
Senator Crowe, Senator Jackson, Senator Oliver, votes aye. Senator Seal, votes aye. Senator Sutherland, votes aye. Chairman Rose,
Aye.
votes aye.
All right. And we'll take a voice vote in the House. All in favor in the House, please say aye. And opposed, likewise, say no. All right. It looks like you have a 4-year extension. At least it moves to the full committee and they'll have a chance to approve what we did or not. So thank you so much, both the auditors and the commission, for an excellent report today. We appreciate it. This does move forward with the 4-year extension. Thank you for being here. Next on our agenda is Department of Education, and we'll ask the agency representatives and the comptroller audit team to come forward. That's right. All right, thank you all for being here. I'm going to turn to the agency and ask you to identify yourself, tell us who you're with for the record, and then we'll go to the comptroller team and ask them to do the same, and we'll hear their report first. So agency, would you tell us who you are and who you're with, please?
Yes, sir. Lizette Reynolds, Commissioner of Education.
Mary Ann Dursky, Chief Financial Officer for the Department of Education.
Sam Piercy, Deputy Commissioner, Department of Education.
All right, thank you. And to the audit team.
Matt Rowland, Legislative Senior Auditor.
Heather Rowe, Legislative Audit Manager.
All right, thank you for being here. And we'll ask you from the auditors, please present your report to us, please.
So, good morning, Chair and members of the committee. We are here to present the results of our 2025 performance audit of the Department of Education. Before we begin with the presentation, we first would just like to thank the department for their assistance and cooperation during our audit. The department's mission is to support and influence districts to improve the quality of teaching and learning, as well as increase access and opportunity for all students. Our audit areas included the department's processes for determining review of participant expenses for individualized education accounts, steps taken for the rollout of the Education Freedom Scholarships, the department's review and oversight of safety plans and security grant funding, the department's oversight of innovative school model funding, including their process to ensure local districts completed sustainability plans, the department's provision of resources and support to target struggling schools, and controls across the department's information systems that protect sensitive data. We audited the Department of Education from July 1, 2021 until April 30th, 2025. In our current audit, we followed up on one prior audit finding and verified that it has been fully resolved. Additionally, we noted one new finding that relates to the department's information system and is confidential according to state statute. Therefore, we will not discuss that finding in this presentation today, but those details have been shared with management. We again would like to thank the department staff for their cooperation and assistance during our audit. They were extremely receptive and helpful throughout the entire audit process. We would also like to thank you, Chair, and members for your time and consideration. And this concludes our presentation of the 2025 education report, and we're available for any questions.
All right, thank you. And before we ask any questions about the audit, are there any questions about the methodology used to conduct the audit? All right, seeing none, we'll go to the agency. Ms. Reynolds, you're recognized. I'll get it right in a minute. Commissioner Reynolds, now I got it.
There you go. Good morning, everyone. Again, we want to thank our partnership with the Office of the Comptroller's Office to make sure that we're meeting the expectations not only of you, the General Assembly, but the Governor's Office and obviously the taxpayers of Tennessee. We concur with the finding as outlined by the Comptroller's Office, and we are working closely with STS and the Information Security Council, or ISC, to resolve the issue as soon as possible. As noted, we have a number of initiatives that we are implementing. This is just a handful as part of the audit. But we also have a number of our program leads here to answer any specific questions about these programs and any others have questions about. With that, we're ready to proceed.
All right, Commissioner, thank you so much. Any questions to either the auditors or to the department? And I recognize Representative Fritz first. No, that was not a question. All right. Do you have any questions from our committee? All right, seeing none. Any from the public? All right, seeing none, do I have a motion? Chairman Crawford.
Thank you, Mr. Chairman. I make a motion that the Department of Education be extended for 4 years.
All right, we have a motion. We have a second. We have a second. Chairman Jackson, thank you so much. Any objection to the vote? All right, seeing none, Madam Secretary, please take the roll call vote in the Senate.
Senator Crowe, Senator Jackson, votes aye. Senator Oliver, votes aye. Senator Seal, votes aye. Senator Sutherland, votes aye. Chairman Rose,
Aye.
votes aye.
All right, we'll take a voice vote in the House. All in favor in the House, please say aye. And opposed? We got one no. Do you need to be recorded? Okay, record that. Monty Prince, Representative Fritz was a no. All right. That being said, moves forward with 4-year recommendation. Thank you so much for being here. Appreciate the auditors and the department. Thank you. All right, the next. All right, the next agency is the Sequatchie Valley Educational Development Agency. If you folks will come forward and good morning. Thank you for being here. If you would, tell us who you are, who you're with, and we'll let you present your report to us.
Okay. My name is Elaine Duke. I'm the Executive Director for Sequatchie Valley Educational Development. And with me this morning is Misty May. She's our Chief Operating Officer, Chief Financial Officer. The Sequatchie Valley Educational Development Agency was originally created by the Tennessee Code Annotated in 1968 as the Sequatchie Valley Planning and Development Agency to serve 5 counties: Bledsoe, Grundy, Marion, Ray, and Sequatchie. Our agency was originally established as a River Basin Authority to focus on public health, education, recreation, planning, and public works. In March 2020, Public Charter Chapter number 664 amended the Tennessee Code to officially change our name to Sequatchie Valley Educational Development Agency and limit our activities to the field of education. This change was critical to properly align our structure with our present mission, which is early childhood education. This is why we are now properly assigned to this committee. Our mission is to build capacity for a successful tomorrow by inspiring children and families to learn and grow today. We are proud to serve over 300 families annually in our 5-county region: Bledsoe, Grundy, Marion, Ray, and Sequatchie. SVEDA operates the Head Start and Early Head Start programs in these 5 counties. We are federally funded to promote the school readiness of children from low-income families. Our core philosophy is a whole child approach that provides comprehensive services beyond just education. We provide a nurturing learning environment for children ages 3 to 5 in our preschool Head Start program. And we also serve pregnant women, infants, and toddlers from birth to 3 in our Early Head Start program. Our research-based curriculum supports their cognitive, language, literacy, and social emotional development. Again, the whole child. We also prioritize child health. We support families in prioritizing family wellness by partnering with them to ensure their children are up to date on well child checks, dental exams, and lead screenings. Our vital screenings often lead to early detection of developmental issues. Therefore, we are integral partners with Tennessee Early Intervention Services and our 7 local education agencies. In fact, our performance standards require that at least 10% of our actual enrollment slots be filled with children with an individualized education plan or individualized family services plan. And also, children often receive their first pair of glasses after being referred to an optometrist from our vision screenings. In addition, we are a CACFP sponsor, so we're serving nutritious meals and snacks to our children that are low fat, low sugar, low salt. But we are multi-generational as well, so we actively engage parents. They are their child's first and most important teacher by offering resources and support to help them to achieve their own goals, such as finding employment or continuing their education. We've built strong partnerships with other community agencies to ensure families receive a stable continuum of support. Sequatchie Valley Head Start, which is under our Sequatchie Valley Educational Development Agency umbrella, is celebrating its 40th year this year as a Head Start provider, as the National Head Start celebrates 60 years. And our recent accomplishments that we'd like to talk to you about are as follows. So on September 16th, 2025, we received the National Head Start 2025 Advocacy All-Star Award. That's a national award for our parents' participation in educating the community about the Head Start needs. Just a few weeks ago, we received $1,033,000 in federal funds to renovate our facility in Ray County. We call that the Dayton Head Start program that supports birth to 5 there in Ray County. And with our governing body recommendation and support, we have significantly enhanced our facility security, implementing IP security cameras for real-time monitoring, video doorbells for building entry and visually identifying visitors, and putting security film on windows to strengthen them and prevent shattering upon impact. Health, safety, and security are very much high priorities for us. I'll let Misty present our financial
All right, again, if you would tell us who give us your name and then proceed.
I'm sorry. Misty May. I'm the Director of Finance for Sequatchie Valley Educational Development Agency. Our operating budget comes from 2 Office of Head Start grants. We total $6,197,425 for this past year. These 2 grants, one we refer to is a Head Start grant, is $4,682,596 of that amount. And our Early Head Start grant is $1,514,829 of that grant. We're a CACFP program. We receive reimbursements from CACFP annually in the amount of approximately $200,000. This past year, our revenue was $171,174. We have and maintain a clean audit history. Our finance department operates with strong internal controls and strict procurement standards. We're proud to report that we have received no audit findings since fiscal year 2007. That's an 18-year period. We have strong federal oversight. The Office of Head Start conducts 2 federal monitoring reviews during each 5-year project period. Our first review for the current 5-year project period is scheduled to begin the last week of October. Our board oversight. Our government board selects an audit firm by full vote and oversees the annual A-133 audit process, with the firm presenting the financial report directly to the board. The board chair receives a copy of the monthly reconciled bank statement directly from the financial institution. Our 12-member governing board is active, meeting on an average of every 2 months. In the last 2 fiscal years, fiscal year 24 and 25, only one of the 12 meetings did not achieve a quorum. Our board does have 3 vacancies and 3 gubernatorial term expirations, and we are currently awaiting appointments to fill those positions. The governor's office agrees with us that it is important that our board of elected mayors, as required by our current state law and agency bylaws, assume local control of board membership, as the mission of our agency is to serve our local communities.
So why should we be continued instead of sunsetted? The absence of our program would have a significant and detrimental impact on the public welfare and the local economy in our geographic service area. Number one, there would be some financial liability, of course. If we were permanently sunsetted, our agency would no longer be participating in the Tennessee Consolidated Retirement System. Our present value of benefits as of fiscal year 25 is $13,441,603. We have 40 people who are actively drawing their retirement benefits and 343 additional persons who are or will be eligible at the appropriate age to receive benefits. And we also participate in the state's local government insurance plan. But beyond that, we are parent choice in our communities for low-income families who can afford childcare. There would be economic disruption, not only because we employ over 115 people, but the parents that bring their children to us might also not be able to go back to school or to go to their jobs without our help. So in summary, we provide essential, comprehensive educational, health, and family support services that act as an anchor for hundreds of families and the local economy in the Sequatchie Valley region. We are an efficient and physically responsible organization that delivers critical federal services to the most valuable members of our community. We respectfully request the committee's support for our continuation.
All right. Thank you so much for an excellent report. Any questions from our committee? All right. Yes, sir. Representative Glenn, you are recognized.
Thank you, Mr. Chairman, and thank you too for being here. I'm just curious, why is it only those 5 counties? Am I missing something here?
That's the way our law is written. So I guess back in 1968, those were the 5 counties that the representatives decided that would be in the Sequatchie Valley Planning and Development Agency. And so we are not allowed at this point to serve any additional counties. That's how our law is written in Tennessee Code Annotated.
Go ahead, Representative Glenn.
Thank you, Mr. Chairman. So you could add more, but your laws are written that you use 5.
Yes, sir.
But of course, if you did more, you would need more money.
Yes, sir.
Okay, thank you.
And Representative Glenn, I believe I'm correct in this. The state is covered by other development agencies. So if you look across the state, we're covering every area of the state, I believe. All right. Any other questions? Representative Fritz, you are recognized.
Thank you, Mr. Chairman. Just a compliment and a thought. I'm sincere in the thought, but do you work with perhaps the other development agencies to bring them in to see what is perhaps some of the most beautiful creation on God's green earth of the Sequatchie Valley? Because I think it would encourage students across Tennessee to realize just what a beautiful area y'all work and serve.
Thank you so much.
Thank you for that comment. Any other comments or questions from our committee? All right, seeing none from our audience. All right, we will entertain a motion. Representative Crawford, or Chairman Crawford.
Thank you, Mr. Chairman. I make a motion that Sequatchie Valley Educational Development AG be extended for 6 years.
All right, we have a motion. Do we have a second? We have a second from Chairman Rudder. Any objection to the vote? Seeing none, Madam Secretary, please take a roll call vote in the Senate.
Senator Crowe, Senator Jackson. Votes yes. Senator Oliver. Votes yes. Senator Seal. Votes yes. Senator Sutherland. Votes yes. Chairman Rose.
Aye.
Votes yes.
All right, a roll call vote or a house, voice vote in the House. All in favor of 6-year extension in the House, please say aye. And opposed? All right, moves forward with 6-year extension. Thank you for a great report.
Thank you.
And your plea for extension, I don't even know if you had to make it or not. I think you had it in the bag, but thank you again for being here.
Thank you.
All right, appreciate what you do. All right, the last agency we'll hear from is the Tennessee Public Charter School Commission. Don't y'all mess this up because we're on a roll with getting these things done. So if you would, please come and we'll ask the agency, once you get seated, to tell us who you are, just for the record, who you're with, and then we'll yield to the auditors for them to do the same. So we'll start with agency. Go ahead.
Thank you, committee. My name is Tess Stovall. I'm the Executive Director of the Tennessee Public Charter School Commission.
Oh, okay. Thank you. My name is Christine Richards. I'm Chair of the Public Charter Commission.
Good morning, Lawrence Walker, Director of Finance and Operations for the Charter Commission.
All right, and I have been corrected. We have no auditors here. So when I saw 5 people, I thought, well, surely you guys are here. So proceed with recognizing yourself, and whoever's presenting will allow you to do that.
Thank you, Chairman. I'm Ashley Thomas, General Counsel for the Commission.
And Hayden Pendergrass, Director of External Affairs for the Commission.
All right, thank you all for being here, and go ahead with your presentation.
Well, good morning, Chair and committee members. The Charter Commission was created by the General Assembly in 2019 to serve as an independent state agency to hear charter school appeals and to serve as an appellate authorizer of charter schools. The full commission meets quarterly in accordance with statute and also holds special called meetings to handle business outside of those regularly scheduled meetings as necessary. Prior to our establishment, the State Board of Education received and voted on these appeals under the original charter school statute in 2002. As chair of the commission, I want you to understand that we work to achieve a quality education for students and parents in Tennessee, and the charter schools are another public school option. Our charge is to be nationally recognized as a top-tier quality authorizer in the state with a strong portfolio of public charter schools. We are structured like any other school district. We are accountable to the same standards as all school districts in Tennessee, and we are reviewed by the State Board of Education as well as several legislative committees. We recognize that the taxpayers in Tennessee are the source of the funds for our students, and our focus is to provide a quality public education while being good stewards of those funds. Now, I'd like to turn the remainder of our presentation over to Tess Stovall, our Executive Director.
You are recognized, Ms. Stovall.
Thank you. Thank you, Chair Richards. Thank you, committee, for having us here today. As our commission chair shared, the statutory charge of the commission is to receive, charter school appeals, and to serve as the authorizer in the school district for any school that the commission approves. The path for charter schools in Tennessee begins at the local district level, where applicants first apply directly to the local Board of Education to establish a charter school. The commission then hears appeals of any amended application that's been denied by the local Board of Education. The appeal process includes a review of the information submitted by the local district. We also accept public comment as a part of our process and directly from the local community via a public hearing. In preparation for our appeal work every year, the commission and its staff goes through a quality authorizing training to ensure that we fulfill this work to the highest possible quality and in alignment with our statutory charge. In 2025, the General Assembly did pass Public Chapter 275, which does allow for direct applications to the commission in certain limited circumstances. We are currently in the rulemaking process for this new statutory charge, and we will have the first part of these rules in front of the full committee this afternoon. Beginning in 2021, the Charter Commission assumed the responsibilities of being the authorizer in the school district for any school that it approves from the State Board of Education. As Chair Richards says, as the authorizer in the district, we are responsible for all the same district functions as any other traditional school district here in Tennessee. Charter school students are required to take all state assessments. Our teachers are held to the same licensure requirements as all other public teachers in Tennessee. As of this current school year, so the 25-26 school year, the commission oversees 24 charter schools. Those are split between Davidson County, Shelby County, and Rutherford County, serving a little over 8,500 students. The commission, as an authorizer, is responsible for holding those charter schools accountable to high academic achievement and ensuring the schools serve all students. We are thrilled to share that the commission as a district has received a TVOS Composite 5, which is the highest level of student growth, for all 4 years that the commission has been an LEA. And 2 of our schools were recognized as reward schools from the Department of Education in school year 23-24. The commission currently has 20 full-time staff. We did receive 4 additional staff in the current year budget. One of those staff positions has already been filled, and we'll be filling the remaining 3. Thank you again for your time this morning, and happy to take additional questions from the committee.
All right, thank you for that presentation. Do we have any questions from our committee? Senator Oliver, you're recognized.
Thank you, Mr. Chairman. Question, how many of your 20 full-time staff or your non-board members have a classroom teaching experience?
I am happy to pull that number. I don't have that number off the top of my head in terms of who of our full-time staff have school-based experience. A lot of them do, but certainly I don't have that right off the top of my head.
Do you know if any of your job descriptions require a classroom teaching experience?
So particularly for our school programs and support staff, which is our staff that work directly over English learners and special education and federal programs, all of those require experience in school-based experience with special populations, English learners, special education, so that they can work with our schools on that.
Thank you. I'd love to have that report if you.
Sure, absolutely.
Thank you. Thank you, Mr. Chairman.
You are most welcome. Any further questions from our committee? From the public? I see none. So we are ready for a vote. Do we have a motion? Chairman Jackson, you're recognized.
Thank you, Mr. Chairman, and I make a motion to extend the Public Charter School Commission for 4 years.
We have a motion to have a second.
Second.
Got a second from Senator Seal. All right, no objection to the vote, then we will take a roll call vote in the Senate. Madam Clerk, please take the vote in the Senate.
Senator Crowe, Senator Jackson, votes aye. Senator Oliver, votes aye.
No.
No, sorry. Senator Seal, votes aye. Senator Sutherland, votes aye. Chairman Rose,
Aye.
votes aye.
And the voice vote in the House, all in favor in the House, please say aye. And opposed? All right, both of y'all want to be recorded as noes. Okay, all right. This moves forward then with a 4-year extension. Thank you so much for being here. Thank you for what you do. Let me remind this committee and the audience and those that are listening that this concludes our business today, but this action that we've taken today will be submitted to the Government Operations Committee for deliberation and final decision prior to being placed on the calendar during the next legislative session. Notice future meetings will be posted in advance, and remind you, we will be back in here at 1 o'clock. Without objection, we're adjourned. Committee, thank you for a great, I guess, meeting. Yeah, that's